Are you sitting down? There's something wrong with your baby's heart. The doctor's words echoed in the room as they diagnosed my child with congenital heart disease. In my mind, all I could think was, is he going to die? Almost 40,000 children in the United States are born each year with a heart defect. Even with advanced medical care, almost twice as many children die each year from congenital heart disease as all childhood cancers combined.
My daughter's name is Madeline Quinn Souter. She was born on November 22nd, 2016, and she passed away July 5th, 2018. At Madeline's 20-week ultrasound, she was diagnosed with trisomy 18 and the heart defect tetralogy of Fallot. When I woke up the morning of July 5th, I never dreamed that Maddie would go to heaven later on that evening. She had a pediatrician appointment that morning, and for the first time, Maddie was gaining a lot of weight. She was doing so well. The pediatrician was so excited. And when we got home, we were all hanging out with her in the living room around her bed, and she was smiling at us. And we were talking to her and telling her how proud we were of her, that she was growing and developing and how brave she was. And suddenly, without any warning, Maddie suffered from a sudden cardiac arrest. We tried and we could not resuscitate her. She passed away in the living room, surrounded by her family and in the place that she loved the most.
Because of warriors like Madeline, we fight to conquer CHD. We need people to fight for our children and our families facing this disease when they feel like they can't anymore. But we can't do it alone. There is no cure. We may not be able to fix their child's broken heart, but we can help them hold the pieces together. Every time you donate to Pediatric Congenital Heart Association of Pennsylvania, you help give resources to families that have just been diagnosed. You offer strength and encouragement for the battle they're facing. You let them know they're never alone.
My name is Xavier.
Xavier went into the hospital at a month old with RSV, pneumonia, and bronchiolitis. And at that time, they didn't know about his heart, and I didn't know about his heart. It wasn't until a week later that his lungs started to clear up a little bit, and they heard a heart murmur. And then they did an echo, and that's when we started to discover all of the heart defects he had. It wasn't until 6 months later we even found out about his bicuspid aortic valve. They went in through his back because his lungs could not handle open heart surgery. 3 days later, when they realized that surgery had gone wrong and they had to do open heart surgery on Xavier. Your child will never be completely fixed. Their heart is always broken in some ways. It has been mended. One thing that I hope for even Xavier's future is for him to be an advocate and to share his story continuously with others so people are aware.
This is Theodore, or we call him Theo. Theodore was born with a couple different congenital heart defects. He had a coarctation of his aorta, a ventricular septal defect, and patent ductus arteriosus. Theodore has only had one open heart surgery, and at this point there really isn't any definitive talk of any more. They fixed his coarctation and his ventricular septal defect, and we are just on routine monitoring to continue to check his coarc. He might need a catheterization down the road, and also to keep an eye on his bicuspid aortic valve that he has. We try to just take every day as it comes and remember it's a blessing that we were given. But we do realize that he will probably have some extra precautions that other kids don't. But we try not to live with fear of what could happen.
CHD is the most common birth defect in the United States, affecting approximately 1 in 100 children. Congenital heart disease is approximately 60 times more prevalent than childhood cancer. Yet funding for pediatric cancer research is 5 times higher than funding for CHD. So we will give knowledge, give a voice, and give hope. Together, we will conquer CHD.